The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. This episode of Supplementing Health is brought to you by AOR's DGL-760. Deglycerinated licorice has been shown to help soothe stomach ulcers, protect the gastrointestinal lining, and stimulate protective defenses to support the health of the digestive system. With 760 milligrams of active ingredient, AOR's DGL-760 is ideal for anyone looking for reprieve from digestive issues. Get yours today at your local retailer or at aor.ca or aor.us. Hello and welcome back to Supplementing Health presented by AOR. I'm your host, Cassie Price, and today I'm joined by Dr. Greg Sikorski, an ND here in Calgary that I have had the pleasure of knowing for several years. So I'm very excited to be hosting him today. Thank you for joining us, Greg.
Yeah, thanks for having me, Cassie.
Do you want to kick off by letting our listeners know a little bit about you and how you got into naturopathic medicine?
Absolutely. I knew I wanted to do something medical related quite early in life. My kindergarten teacher even remembers me going on a field trip and playing doctor, and she bugs me about it. I went to Mexico. I got a parasite attack. So I had some gut issues, got that repaired, or so I thought. And then I got in university into a car accident and got whiplash. My GP was really helpful, or as helpful as he could be. He sent me for massage. He told me to go to physio, told me to go to a chiropractor. I had my first acupuncture experience in the physio, and I hated it. I thought it was crap. The chiropractor helped me a little bit more, got me to about 65% better, and I really liked the approach. So I thought I was going to become a chiropractor. And naturopathic doctors came to the University of Calgary for a career fair. And I thought, why would I want to be that kind of doctor when I could be a real doctor? And then I got in another car accident. I ended up in the hospital, and I thought it was the worst place to be. It did not feel like a place of healing, and it's not a place I wanted to work. So here I was convinced I was going to be a chiro, and a friend of mine told me she was going to be an ND. This was somebody smart who I respected, and I thought, oh, there must be a little bit more to this. So she recommended that I apply for her previous position as a receptionist at a clinic, and I had this amazing experience. I met three different very different NDs, and I got to see how creative it is, how interesting it is, how they look at more than just one area of life. And they helped me see that my back issues actually started with the guts and the parasite attack. And once I was able to deal with this parasite attack, I could get way better with the back. And it just made such a huge difference. It was more than just adjustment. And this whole picture way of seeing the world, seeing the body, made me fall in love with it.
That's fantastic. So now that you have your own practice, what are some of the common things that you see coming up when you're facing patients with a similar mentality as your previous self, that think naturopathic medicine is old school mentality or a bit of crackery and doesn't really realize how much science goes behind it?
It's really fun to chat with some of these people. as long as they have a really open mind. I love showing them the mind maps of how I would take different approaches and showing them visually where your guts may affect, how low stomach acid affects the body. The educational component is so important, and it's such a pleasure guiding people down this road. Um, it's fun talking about a magic pill and wishing that we could do this instant gratification and snap our fingers and we're all better, but not everything is as black and white as we would like it to be. And showing people it takes this long for us to have gotten to this point of unhealth, and it can take about that same amount of time to build back up to health. And showing people this mentality really is fun, and guiding them through it uh, allows me to show them lots. There's more time in this approach to get deeper and incorporate mental and emotional factors that affect us too. And also showing them how that happens, it's neat when that light switch does come around.
Yeah, definitely. It's interesting watching how conventional and naturopathic medicine can work together. You and I have had conversations about this over the years, but there's a place for both really in our healthcare system. I think we both agree that there is a time and place for conventional as well as a time and place for naturopathic or functional medicine coming in to help people along their healthcare journey or along that healthcare spectrum. So what I wanted to chat about with you today is where we hit that point where pharmaceuticals or conventional medicine has played their part, and now it's you come in to help start shifting people over to the healing side where they can start to move away from the conventional and into more of a healthy lifestyle. So do you want to talk about some of the pharmaceuticals or medications that we commonly see today and how that shift looks?
Yeah, absolutely. There is definitely a time and place for medications. They are absolutely needed in certain instances. And while my patients are on medications, I want to make sure that they're doing it properly. Medications are kind of like police officers. They help us direct our pathways, our natural pathways in our system, and make us go down this road. And the more that we go down this road, the more that this road gets used. And pieces start falling away. We might get potholes. The shoulders might not be as noticeable. And vitamins and nutrients help us rebuild these roads so that we can use this system more and more and more, this pathway over and over again. And the less likely we are to have side effects.
Can you give us an example of like maybe a common drug that we see that happening with that people maybe aren't as aware of how it's affecting those other pathways when you think it's, a medication is labeled for one specific ailment or condition. People don't always, like, I know I was surprised by some of the ones I've learned over my career and the way that they affect those different nutrients. So can you give us maybe a couple specific examples?
Yeah, so the first one is the birth control pill or hormone replacement therapy. A lot of women, especially if we're not having proper diets, if people are smokers, if they're drinkers, um, there there are certain we're not getting those nutrients in our diet as much, and so for example, with birth control pill, B12, B6, magnesium, folic acid, riboflavin, which is B2, zinc, tyrosine, vitamin C, all of those can be depleted um, in our systems. With a lot of the estrogens, the same kind of things, B6, magnesium, CoQ10, vitamin C, folic acid, can really be depleted and cause potentially more pain, more suffering, more migraines, um, muscle joint pain, um, eye irritation, poor wound healing, affect our thyroid, um, prevent people from having weight loss, constipation, fatigue. So that's just a little bit of what can happen with birth control and or estrogens and progesterones.
So it's quite a long list there of different possibilities, especially for, I know, like younger women when, you're already dealing with PMS symptoms in some cases, and a lot of women take them to help counterbalance some of those issues like the acne and the PMS symptoms like cramping and that sort of thing. Whereas if it's depleting magnesium, I mean, we've had a couple previous episodes where we've talked about kind of what a miracle element it really is, where it really helps with muscle function and so many other functions within the body. But PMS cramps are partially muscle function. So if you're depleting that one in particular, you could actually be making those symptoms that you're trying to counteract worse. So do you have suggestions on how women could either supplement their diet or adjust their diet to start to balance some of those nutrients or make sure that they're getting those nutrients replaced?
Yeah, and usually I start with blood work to see which nutrients are being depleted. And it's not to say if you go on these hormones that you need to go on them right away. Usually these effects don't happen until, let's say, 6 months down the road. So after about, let's say, that first 3 months, when it gets in your system and starts to get used, then I would consider maybe doing some blood work or at that 6 month point. But yeah, I'm sure just like in your other talks, lots of leafy green veggies tend to be really good. The more organic, the better. Magnesium's kind of a harder one, just because it is a little bit harder to get in our diet. That is one I do kind of supplement in a lot of people's as a supplement. So for example, with the B2, that can be reduced. There's watercress, brown rice, rose hips, parsley, dandelions, dulse, kelp, fenugreek. B6 you can find in whole grains, eggs, the egg yolks, peas, carrots. B12, some of the food sources are cauliflower, broccoli, alfalfa, miso, seaweed, catnip. Zinc can be found in beets, broccoli, fish, lentils, oysters, wheat bran, wheat germ, garlic, ginger root, parsley. Those are some examples.
Fantastic. And so when you see people that are on these medications and need the additional supplements once you've done the blood work, do you usually start with diet or do you start with a supplement? And how do you make sure that the body is absorbing that? Do you have any kind of tips or tricks for people to increase absorption of these supplements or these nutrients while they're still on those medications?
Yeah, and usually we figure out how their gut is working, how their bowel movements are, because if you are, for example, don't have enough B12 and you might have some constipation, it's hard to make sure your gut is working properly. So you might need something like B12 injections. You might need something to get your system running, such as IV therapy. It's sometimes we might need L-glutamine to help heal the gut, or making sure that underlying conditions such as celiac disease is taken care of. And that we are avoiding gluten, we are avoiding those wheats and those hidden sources. There's quite a bit that I do look at, and I wish there was a quick, easy answer to say, yeah, just do this or do that, but everyone is so individualized. One thing I do like to check is making sure that stomach acid is properly where it needs to be. And a lot of people, they're on antacids or proton pump inhibitors, which can also decrease different nutrients and vitamins. Proton pump inhibitors work a little bit differently than other nutrient depletions. So this isn't because we're using a pathway over and over and over again, and we need those resources to build up the pathway. This is preventing things from getting in you, preventing things from digesting properly. So a lot of people will go on proton pump inhibitors because they they get heartburn. But what is the cause of the heartburn? Is it your lower esophageal sphincter isn't closing? And sometimes it doesn't close because we don't have enough stomach acid. And if we're in a state of feeling way too stressed, our body doesn't get to that rest and digest place, and we don't have that stomach acid. And stomach acid is needed for so many different things. Not only does it break down our food, but it's one of our first lines of defense, um, and can really help us and our immune system. So one issue I have with proton pump inhibitors is I see a lot of people who have SIBO, which is small intestinal bacterial overgrowth. And the longer they've been on it, the more dysbiosis or overgrowth of this bacteria happens. It's kind of like having a garden and you have a whole bunch of weeds invading your garden. Um, and and that's what dysbiosis is. So we have to deal with getting those weeds out of the garden, making sure that we have proper plants and veggies and our fruits and flowers and all the good stuff, the good bacteria in our gut. One story I like to share is I have one person in particular who was so worried about their heartburn, they didn't want to come off it until after retirement. And their GP had been telling them for many years to come off on the proton pump inhibitor. So this is like Prevacid or omeprazole, Prilosec, just some names to throw out there. On the actual insert, it says do not take longer than 6 weeks. But a lot of people in the Western medicine kind of idea with GPs, they don't have a lot of different medications for helping with stomach issues. And so it keeps getting changed. So it used to say 6 weeks. The inserts, pardon me, it still says 6 weeks, but people are being put on it longer and longer, in about 2 years kind of thing. This
I
person
think
had
too, a
been,
lot more people are using it nowadays as well, especially as we live a faster paced life and, we're eating on the go a lot more, which means we eat processed a lot more. You're getting that higher sugar, that higher saturated fat, all of those kind of triggers that really make the body work harder as well, right? When they're eating. So I think it's one of those, like you said, quick fixes that people are looking for. It's like, I'm uncomfortable, so I'll just take this antacid here and it'll solve all my problems. But like you're saying, it actually perpetuates them.
and this person in particular, they'd been on it close to 20 years. Um, yeah, and after being on this medication for so long, they started to notice that they got osteoporosis, but they didn't put two and two together. And I'm not sure if their GP mentioned it, but I do know that they were trying to get them off of this medication. Um, and yeah, there were some other issues. They had celiac disease, so they already had some absorption issues. But they'd been off gluten for years and taking some of the enzymes that help break down gluten. So if they get some cross contamination, they don't have as bad of a reaction kind of thing. And then they started noticing that they were breaking bones every year. And they would get an IV every once in a while and they would notice a huge difference, but didn't put the two and two together. And so I was able to help them see that and finally get them off the proton pump inhibitor and helping heal the gut. And so, yeah, it's a very interesting medication because it does have problems down the road for sure, long term.
So
And
specifically, what kind of nutrients do PPIs deplete most commonly?
yeah, so this one's B12. So for energy, fatigue, anemia, weakness. There's calcium, which is needed for the bones, can help with numbness, muscle pains, help with the heart. Um, it can affect magnesium, so we talked a little bit about that. Weakness, muscle pain, also abnormal heart rhythm. Some personality changes. Some people, if they don't have enough, they also get migraines. It can affect zinc, which is needed for wound healing. It can change the taste in our mouth. It can cause erectile dysfunction, hair loss, diarrhea if we don't have enough of these nutrients. Folic acid is another one, which can be gingivitis, shortness of breath, irritability. It can decrease probiotics, causing upset stomach, anywhere from diarrhea, indigestion, constipation, vaginal infections, weakened immune system. And then the last common nutrient is iron, which once again for anemia, fatigue, weakness, brain fog, muscle pain, restless leg syndrome, lowered body temperature, and also immunity too.
Okay, so for people who are considering using antacids or are already on them, how do you usually go about figuring out that root cause, whether or not it's too much stomach acid or not enough? And then what would some of your suggested treatments possibly be based on, what the outcome of those tests would be?
With the proton pump inhibitors, it's a little hard to see if it's too little or too less at that point when they come to see me, because usually it's way too low at that point. So it's hard to test whether their stomach acid is low or high because it's automatically just going to be low. So there's some certain herbs, some demulcents. DGL is one that I use a lot of in my practice. It's a really good one to help slowly bring somebody off their proton pump inhibitor. And then once we get off of it, once we deal with the stress of, because it's kind of like that fight or flight reaction, we either, if we're in that fight or flight, we're not in rest and digest. And so that rest and digest side of us starts to really get affected. And so if we're not dealing with stress, no matter what we're going to do, we're not going to help our gut out. So stress support is one of the best things. So whether that's nutrient IVs, whether that's acupuncture, whether that's supplements to help with the adrenals, possibly go to counseling, doing meditations. It sounds kind of weird, but those are one of the basic best steps that we need to address in order to make sure that we can come off those proton pump inhibitors.
Absolutely. Well, and especially in today's society, I would say we are all almost perpetually stressed, right? Without even realizing it, we don't take the time to slow down and relax the same way that our ancestors did. So I think kind of suggesting some of those additional ways of de-stressing is amazing, because I know even myself, like I'll forget how busy I am. It becomes your new norm, and I think people get so busy and wrapped up in their day to day that they forget to almost check in with themselves, right?
And yeah, and a lot of people, when they think of stress support, they think, oh, I need to make time to take a bath and sit there with candles and cucumbers on the eyes, kind of thing. But that can stress people out more. Going out for bike rides, playing the piano, doing something where you're present in your day, where you're not thinking about the past, you're not thinking about the future. That is kind of a mindful meditation and one way to really de-stress.
That's one positive I've noticed that's come out of what we've been experiencing this year with the pandemic. And, as much as having been locked down and having, new viruses to be concerned about and readjusting our schedules, I've noticed there's been a lot more people getting out and enjoying more physical activity. So from my perspective, I think that's one positive that's come out of a negative situation.
Mhm. And the other positive part for helping with stress relief is saying no, the power of no, that it's okay if you don't feel like going out. Um, you don't have to feel that pressure, and no can be such a powerful and stress relieving word. That's one thing that I've really noticed with people too, is we're more understanding of, oh, this person doesn't feel like it. That's okay. We're all in this part together, and it can make it easier to say no.
Yeah, absolutely. Okay, so that's really awesome to talk about because I think lots of people have either used antacids once in their life or, like you said, are regularly using them due to whatever their underlying symptoms are. But another medication that I see is very prevalent in our North American society are statins. Have you had patients come to you that are on those that want off, or have you noticed they help lead to any sort of nutrient depletion, or have any side effects that go along with them?
Yeah, statins are a funny kind of drug. Um, Usually it's a sign that there's other things going on with the body. So if and people are kind of resistant to changing statins, which I'm fine with. I want to meet people where they're at, and if they don't feel comfortable coming off a medication, then absolutely let's support the system as much as possible. So statins include Crestor, Lipitor, Simcor, and one of the biggest depletions is CoQ10. And CoQ10 is needed for the electron transport chain, um, which helps us get energy. And it's a really important. I think it was back in the 50s or 60s, if I'm not mistaken, when they first started looking at these statins and seeing, oh, it actually does deplete CoQ10. So I'm surprised more people don't know about it depleting this nutrient. Um, and then there's vitamin D and vitamin K that it can deplete too. These are kind of the more important ones. And these, as most people know, vitamin D is the sunshine vitamin, helps with mood, helps with bones. And vitamin K2, yeah, also helping blood vessels, atherosclerosis, um, bones and muscles. There's a lot to all these different vitamins. And if you don't have enough CoQ10, it can also give you muscle pains, muscle aches, and make you feel more tired. Um, and yeah, so I do mention these depletions, and sometimes there are other diet and lifestyle changes that I do like to recommend to come off the statin. Um, some people, they're like, okay, well, give me a time frame and let's experiment with this. So I like to, yeah, and even with their doctor, I like to say, hey, give me 6 weeks, 3 months to try and get this person off a statin. And if we can't get them off the statin, sure, let's go back on it. But if we're back on it, make sure that we're taking the CoQ10, the vitamin D, and K2. Um, and yeah, for most of my patients, it's simple little things that we can do. I have a checklist of about 15 different things, anywhere from sleeping 8 hours a day to having organic soy milk, depending on the person. Um, Different dark chocolate can also help get people off statins. Um, Not that I'm saying go out and have tons of dark chocolate, but like there are
Moderation.
moderation and uh, just these kind of 15 different things to do. The more you do, the more likely we can get you off some of these medications.
So it's really
Um,
more about integrating in lifestyle changes to help support the body, not strictly removing the medications, but making sure that we're supporting. And
if applicable, removing, right? But it's not, nobody should be on medication. It's just if we are using medications, to do it responsibly and ensure that we're supporting the body in those processes.
Yeah, and yes, I come from the idea that we tend to be more nutrient deficient versus medication deficient. There are some really neat medications out there like metformin that newer studies are showing, and old studies, how it can help with cancer care. So some of these medications I'm ecstatic about. I'm glad my patients are on them. Um, and for example, Synthroid, which helps with the thyroid in people. No matter how much we try and do nutritionally, for some people, they just need to be on this medication, or they've had a piece of their thyroid removed, so they need this medication. And so while they're on it, I want them to be responsible. So with Synthroid, um, it usually is pretty benign and fine to be on Synthroid, but in some cases we need calcium. With the metformin, it can deplete folic acid and B12, and so if people who have had cancer treatment, for example, their nerves get really fried, and I use a little bit more of the folic acid, not the B12 as much, because sometimes the B12 can make some cancers grow a little bit faster, or find a type of B12, a more natural type that doesn't have a huge amount in it, and really help people out that way and make sure that not only are we helping protect them from getting cancer down the line, but they are taking the proper nutritional support, because of all these other factors that cancer can have a role with.
It's super interesting, especially as we make these advances, how we can get nutrients to work together with these medications. This talk has been super enlightening, and there's a lot, of course, we could go on probably for hours talking about the different ways we can support this. But unfortunately, we've hit the end of our time for today. So if any of the listeners wanted to get a hold of you and continue this conversation directly with you, how would they go about doing that?
Yeah, they can get a hold of me through my website, www.gregnd.com, GREGND.com, or through Facebook, Greg Sikorski, ND.
Okay, wonderful. Thank you so much for joining us today, Greg. It's been fantastic, and we'll have to get you back in the future for another conversation.
Yeah, that sounds amazing. This was fun. Thanks.
Thank you all for joining us today. We look forward to having you back to listen to another episode next week on Supplementing Health.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.